Every day, thousands of people struggling with drug addiction are locked behind bars instead of being offered treatment. Despite overwhelming evidence showing that addiction isn't a moral failing, it's a chronic disease. And when we punish a disease instead of treating it, we fail the individual and the community. Drug addicts should be sent to treatment centers instead of prisons because incarceration does not address the root cause of addiction, while medical treatment is far more effective and leads to safer communities. I became invested in this topic after researching addiction science and criminal justice policy through organizations like the American Medical Association, the Office of National Drug Control Policy, and National Addiction Treatment Institutions. The evidence is just overwhelming. Treatment works, punishment does not. First, I'll explain why addiction is a chronic brain disease that requires medical care. Second, I'll show how treatments lead to better outcomes and reduces crimes. Finally, I'll explain why treatment is dramatically cheaper and more effective for public safety. Let's begin by understanding why addiction is considered a disease, not a crime, and what that means for how we respond to it. The American Society of Addiction Medicine, the nation's leading medical authority on addiction, stated in its 2019 definition that addiction is a primary chronic disease of brain reward, motivation, memory, and other related circuitry. This makes it clear. Addiction is fundamentally a medical condition. Researchers at the Hazelden Betty Ford Foundation, a top addiction treatment institution, reported in 2020 that addiction relapse rates fall between 40 and 60%, comparable to chronic illnesses like asthma and diabetes. The experts point out that relapse doesn't mean treatment failed. It means chronic diseases require continuous care. Medical ethics tells us the same thing. Prisons are not treatment centers. In 2021, the American Medical Association reported that medication-assisted treatment is feasible, evidence-based, and an essential life-saving intervention. Yet many prisons still refuse to offer it. A 2020 legal analysis in the AMA Journal of Ethics explained that people with substance use disorders are legally considered disabled under federal law, and withholding necessary treatment in custody can qualify as cruel and unusual punishment under the Eighth Amendment. Now that we understand addiction as a disease requiring treatment, let's look at what happens when addicts are treated versus when they are incarcerated. The National Institute on Drug Abuse, a federal research agency, reported in 2020 that 40 to 60% of people with addiction relapse when they do not receive treatment. This is because incarceration does not treat the brain changes caused by addiction. The National Association of Counties found in 2019 that 60 to 80% of addicted inmates reoffend after release. Prisons simply do not break the cycle of addiction or their related crimes, but treatment programs do. A 2013 RTI international study showed that diverting addicted offenders into treatment reduces crime and could save the criminal justice system billions of dollars. And 2022 data from National Drug Courts and Chest Health found that people who complete these drug court treatment programs are 66% less likely to be rearrested than those who go to jail. Treatment clearly creates safer outcomes, so let's look at its financial impact. According to USA Facts, a nonpartisan government data organization, they state states spend a median of $61,000 per prisoner per year, with some states exceeding $100,000 annually. Meanwhile, national treatment cost data shows that outpatient rehabilitation averages around $5,000 per year, and even residential treatment generally ranges from $15,000 to $20,000. The White House Office of National Drug Control Policy reported in 2016 that every dollar invested in treatment returns $11 in reduced healthcare, criminal justice, and societal costs. RTI International's economic modeling found that diverting just 10% of nonviolent drug offenders from prison to treatment would save 4.8 billion nationwide. Since treatment is more effective and dramatically cheaper, let's bring everything together. Medical authorities like ASAM, NIDA, and the AMA all agree addiction is a chronic disease requiring treatment, not punishment. Research from Hazelden, Betty Ford, and NACO shows that without treatment, relapse and reoffending rates remain extremely high. Treatment programs, from drug courts to individualized rehabilitation, consistently reduce crime, save lives, and create healthier communities. And the financial savings are undeniable. Treatment is a fraction of the cost of incarceration and delivers substantial economic benefits. For the sake of public safety, fiscal responsibility, and compassion, we must treat addiction as a medical condition it is. Sending addicts to hospitals instead of prisons will save billions of dollars, improve countless lives, and build safer communities for everyone. Thank you.